Welcome to California in Focus. I'm David Mastio, and today we're talking about research on transgender, not surgeries, but puberty blockers and hormones for kids as young as 8. Joining me today is the Center Square's California reporter, Kenneth Trupp. Kenneth, what's the latest news?
It turns out that a major study from the largest gender youth clinic in the country, which is in Los Angeles, is currently being withheld from publication because the author fears that the results could be, quote, weaponized against the practice of giving children puberty blocker hormones. This nearly $10 million study found no improvement in mental health for children receiving puberty blocker hormones, which contradicts this earlier Dutch study from 2011 that has been used as the basis for policies that enable children to receive puberty blockers. The children who received these puberty blockers in the study had an age range for input qualification between 8 and 20. We don't have the exact ages of people who were in the survey, but we can see is that those receiving puberty blockers were an average of 11.2 years old.
This is not the first study to try and replicate that Dutch study that failed to find the same results. Is that right?
Correct. As I said, that Dutch study came out in 2011. So the United Kingdom, when that study first came out, they said, okay, we're going to go ahead and try and replicate these results. In 2016, they had wrapped up the study and found that there was really no change in the improvement of mental health of these children. And going back to this Children's Hospital Los Angeles related study done by Dr. Joanna Olson Kennedy. She's the medical director of the Center for Trans Youth Health and Development at CHLA. She said that these children are, quote, in really good shape when they come in, and they're in really good shape after 2 years, regarding the lack of improvements or declines in the children in the study. This data that she submitted on the 95 children coming in did suggest that maybe these children are not in, quote, really good shape. Of those 95 incoming test subjects receiving puberty blockers who had a mean age of 11.2 years, 28.6% had depression, 22.1% had anxiety, 23.6% had ideated suicide, and 7.9% had attempted suicide in this group of children whose average age was 11.2. These participants said that they realized their gender was different than their sex designation at an average age of 6.4 years.
When she says that she is worried about the weaponization of the scientific research that she's done, and that's why she has deep sixed this study, does she mean that perhaps doctors will be less likely to give puberty blockers to children as young as 8 if the results of her study were known? And isn't that the normal process of science? You do a study, the study says there's no benefit to this, and so you stop doing that.
Well, let's look at what happened in UK, and then we can get back to that. So when that UK study was completed, and they found in 2016 that no, there weren't any mental health improvements for these children in one of the puberty blockers, they didn't go public until 2020 with the actual full results, by which point children were already being given puberty blockers as a standard treatment by the National Health Service, which is pretty much the government healthcare that everyone is on in the UK. But after that study came out in 2020, the NHS stopped giving the puberty blocking drugs to children outside of this new small clinical trial that they're doing. It looks like something similar will probably end up happening in the United States. The doctor who is sitting on this study, she is an expert witness in a lot of the court cases against some of the 25 states that have banned or limited surgeries, hormones, and puberty blocker medical interventions for transgender identifying children.
So she's worried about this being used in court.
Exactly. She's saying court is what she's afraid of. That's pretty much word for word what she told the New York Times. She says that this study could be used to argue in court in support of bans against puberty blocker use in children, especially considering this is a large $10 million study. The United States Supreme Court is hearing oral arguments against Tennessee's ban on transgender identifying children receiving sex surgeries, hormones, and puberty blockers. And the outcome of this case could really have national implications. It'll be a test of whether or not these 25 states' bans are going to be upheld or not.
Thanks for joining us today, Kenneth. Listeners can keep up with this story and more at thecentersquare.com.